Hello and welcome to another edition of Healthy Hangout sponsored by Baylor Scott and White Health. We're here to talk to you today about a very important illness going around. I'm Dr. David Winter from Baylor University. Joining me are two Dr. Roger Caton. Hello, Dr. University Medical Center. Hello, Dr. Wiley.
Hello, Dr. Winter, Dr. Caton.
Well, all over the news in the headlines is Ebola virus, a scary disease, and appropriately so. We're going to talk today, though, about something that may be even more important for most folks in this country. Last year, 35,000 deaths in America were attributed to influenza, 200,000 hospitalizations due to the flu virus. Probably more important to get a flu shot because it seems to work for most folks than to worry about Ebola. Ebola's scary. But let's talk about influenza. Dr. Caton, what are you telling your patients about the influenza virus this year?
Well, most people always ask if they need the shot or not. I always tell them that one of the biggest concerns for influenza for us is from the deaths from respiratory illness or pneumonia or dehydration from it. So I recommend all my patients get the flu vaccine, and I'm pretty adamant about it, like you are and like Dr. Wiley are, and I'll even get on my knees and beg people to get their flu vaccines. As long as they don't have an allergy, I tell them, please get the flu vaccine. It's one thing that you could do to prevent an illness, and it's a very good one. It's pretty effective. I know we're going to talk about its effectiveness in a few minutes, but it's a very effective vaccine. It's very useful. And if you get the flu, like some of us do with the flu vaccine, like I've had the flu 5 times despite taking it for 25 years straight, which is the effectiveness basically for the flu vaccine, that at least your flu, the duration or your symptoms are decreased.
You know, we're serious about influenza shots. We do encourage every patient to get one. And in fact, in our workplace, at Baylor Healthcare System, Baylor Scott and White North, we call it now, we require every employee to get a flu shot. If you don't get a flu shot for some reason, you're allergic to it or have some other grounds for not getting the flu shot, you have to wear a mask the entire winter season. We're serious about this, but still some of our patients don't want to get one. Dr. Wiley, what do you do with these folks that are recalcitrant about getting the shot that seems to work so well?
Well, you know, I think the important thing is to dispel myths. So I always ask my patients, why are you not getting the flu shot? And some of the common answers that I get from my patients are, well, I've never had the flu. And I always say, well, neither did the other person or, have the flu, or the lady who died last year, she didn't have the flu. I'll just kind of pull an example. And I'll say, just because you didn't have it in the past doesn't mean you're more susceptible or you're susceptible to not getting the flu this year. And so I really try to encourage patients. Another myth, we all hear this in our practices, of course, is that you can get the flu from the flu shot. So I try to explain to my patients exactly what's going on when you get the flu shot, and basically what I tell them is that the influenza vaccine is teaching your immune system what to do in the event that you're exposed to the flu. So I said you can't actually get the flu from the flu shot. Sometimes people are infected because it does take 2 weeks before the flu shot actually takes full effect. So sometimes the people can get, become infected with influenza in that time frame. And so I think just dispelling the myths and finding out why people don't want to get the flu shot, most of the time I'm able to convince them to get the shot.
I still hear that. I got the flu last year from a flu shot. It's actually a dead vaccine, so it's impossible.
Right, exactly.
Viruses come around. If you get a cold virus and you had a flu shot, you blame it on that. But it can't be from the flu vaccine.
Right.
People are resistant about this. Does the flu shot really work? Now, you mentioned this. How effective is the flu shot?
Well, it depends. There were several studies done. One was in the Journal of Infectious Disease, some are in the Annals of Medicine, and one was by CDC. It can range from 79% all the way up to 90% effective for the flu vaccine. So I would say, given that chance, I would take the flu vaccine to try to prevent or reduce my risk for the flu for either A or B. And this year it's a quadrivalent that we're giving for most influenza.
The other thing is that if you do happen to get the flu and you had a flu shot, you get a much milder case. I had 2 patients last year. They had kind of a minor illness. I said, you know what, if you had the flu shot to protect you. I actually did a test. They did have the flu. So it's a much milder illness if you get the flu and you had a flu shot. Another reason to get that. Now, Dr. Wiley, you give flu shots in your office. Is that where you want your patients to get them? Where else can patients get a flu shot?
Yes, thankfully there's so many avenues in order, there's so many ways to get the flu shot, so many avenues that patients can take if it's inconvenient for them to come into our office. They can also receive the flu shot at their local pharmacy, and some people's, employees are offering flu shots at their job. So if they offer it at your workplace, you should get it there. If you can't do it there, you can get it at a local pharmacy. So anywhere that they're offering the flu shot, anytime it's available, get your flu shot.
You're like me. I don't care where you get it.
Right.
Get one, and then let the doctor know so they can keep a record of that.
That's right. That's right.
Take on the flu. What are the symptoms of influenza? A lot of people get this confused with other illnesses. How do you help them differentiate, or how do you differentiate yourself when somebody comes in with some symptoms that might be the flu?
Most of the times what we tell people is very high-grade fevers, fatigue, prostration, cough. Prostration meaning you're just so fatigued you just don't want to get out of the bed. Every muscle aches. We call that myalgias. And then like you're having a very deep cough. It can be productive at times, but usually it's a very dry cough. And you are just feeling awful. Your fever is like 102, 103, 101 and above. And you're feeling like you just have no energy of what to do. Usually, I always tell people if they're having GI issues with the fever, that's not usually the flu, as we can get that later on in the flu from other issues, but usually you don't present with diarrhea, nausea, and vomiting. You present with coughing, the drainage, nasal congestion, and they feel awful. And as you and I and Dr. Wiley we've all had the flu too on certain times, so we know exactly how you feel. It's onset comes on, you know something's not right. Your body's aching, you just want to go to bed. You don't want to do anything. But those are the times when we got to force ourselves to stay hydrated, because the biggest risk for all of us is dehydration from this viral influenza.
Yeah, and a cold virus usually is much milder, so it's a different illness. You're much sicker commonly with influenza. Now, Dr. Wiley, when people are sick with this, there are actually some pills we can use to treat it. In my view, you ought to get the shot. It works better. It's much more effective.
Mm-hmm.
But there's some pills that we can use. How would patients know that they need those? How do you instruct them on the phone, or how do you figure out when they come in whether they would benefit from something to treat influenza?
Well, at one time, it was recommended that if you are a high-risk patient, that you should be the one to have preference for the flu pill. There's a flu pill, and then there's an inhaled medication that will treat the flu. And, at that point, when there was a shortage a few years ago, we would mainly, tell people who had chronic medical illnesses, or if you were at high risk for complications of the flu, we would try to give preference to those patients. The medications are, a little bit more readily available, and so patients who have a household exposure, so if someone in your home has the flu and has been diagnosed with the flu, and we want to prevent the flu, so we give medication to those people. And then if you're one of those high risk people, and we probably will get into that, but I'll go ahead and mention the high-risk people are pregnant patients. If you have chronic medical illnesses, we're not pediatricians, but children less than 2 years old or adults older than 65 years old. If you're one of those, if you're an obese patient, if your BMI is greater than 40, you should, all those people that I just named, they should probably have preference or should call their doctor soon so that they can get what we call treatment for the flu. And Tamiflu is the medication that we give, and then there's also Relenza, that's the inhaled treatment for influenza.
Mm-hmm. So the flu shot's the best way to prevent influenza, but also we can lower our chances by folks that are coughing, sneezing.
Right.
And this custom we have, Dr. Caton, we still shake hands in this country. It's a custom. That's a pretty darn good way to spread influenza, is it not?
That's right.
Yes, a lot of people will always ask, like, where did I get the flu? How did I get this? And the most common thing is it's just on your hands, you're coughing. Like simple things like going in the grocery store and touching the grocery cart. You'll notice more grocery stores are carrying sanitizers to clean the grocery cart. You can get it anywhere. And you and I and Sharice are very friendly people. We want to shake hands. A lot of people are now doing the knuckle bump instead, where you go like this to another person instead of touching hands. But during the flu season, there are a lot of times when I'll tell people, do not be offended, I'm not going to shake your hand. I'll tap them on the shoulder or say hello, or I'll smile very nicely. I may not shake their hands, and if I do, I go, don't be offended, I'm about to wash my hands and use sanitizer. but it's to prevent any spread of your germs or mine to each other.
Yeah, I use those sanitizer. I like that spray stuff. I spray it on a lot of kids. If I'm shaking somebody's hand, I'm going to discreetly put this on my hands, spread it around well, or sneak off in the bathroom and wash my hands, because that's exactly the way you spread it when you enter your face from that. Dr. Wiley, what about folks that have influenza? Now, do you want them in your office? What do you tell them to do if they call, say, I may have the flu, can I see you today?
Well, you know what? It's okay to treat the flu at home if you're not having any complications of the flu. So when those people call in, you know, depending on who they are, a lot of our patients, you know, they'll do a pretty good job about giving us their symptoms over the phone. And so if we think that they have the flu and we question them really well, we will let them stay at home, and we're okay with treating them. You know, sometimes we'll bring them in if they are, you know, one of those high-risk patients that we talked about, or if they're having more complicated symptoms. We want to make sure that they have not developed any of the complications that Dr. Caton talked about, such as pneumonia. So we sort of just, you know, do a case-by-case basis, but, you know, really, if you have the flu, you should stay at home. You shouldn't be at work. You should stay at home so that you can get well and not spread the germs, because the germs, as we know, the flu can be spread, you know, like a day or so before you even show symptoms, and then about 5 to 7 days after symptoms. So, you know, the flu is an infectious virus, and so you want to stay at home so don't spread it around to the people in our office and to us as well.
And so if you do come to our office, we're going to ask you to please put on a mask. Hope you're not offended by that, because that's where you keep from spreading to us and to other patients in our waiting.
That's right. That's right.
Now, we're also going to ask, in light of this Ebola thing, Dr. Caton, we asked a couple questions. These are going to be paramount now when folks come in with the flu, to make sure we're not missing that. So what do you expect? What are you going to ask your patient when they come in with a flu-like symptoms or with a fever? How are you going to help distinguish this from that Ebola stuff that's out there?
One of the difficult questions about Ebola, and that we've been going through, and we're going to have another town hall meeting in Lakewood later tonight, is they were discussing about the hemorrhagic fever, the bleeding that occurs, the high fevers, the nausea, the vomiting. But it is specific about travel history is one of the major things we ask for. The other thing, now that we do have an Ebola case here in Dallas, is to ask them if they've had contact with anyone who's worked close to the person at Texas Health Resources, unfortunately, because they have about 125 contacts that they have quarantined. And so if the person knows them or has been close to those people who may have had contact and then had a fever develop, usually within 2 to 21 days, then we ask them to go ahead and come in. But we ask them that unfortunately most offices don't have complete protective gown and clothing. So if that is to be done, the CDC has recommended we make sure that they go to an ER that is prepared and with the risk that we know it's Ebola, so we can put them in contact isolation and negative pressure isolation right now, so that we can limit the risk of contact points for these people who may think they have Ebola.
Indeed. So if you have a fever out there and you're sick, be prepared to answer the question. If you had contact with someone who's had Ebola or exposed to it in the last 21 days, if you haven't, we're not particularly worried about those folks. It's not spread out there on the streets of Dallas. You have to have direct contact with someone who has that. So, Dr. Wiley, we need to help with this concern about folks in Dallas, Texas. There's a couple cases of Ebola out there, but what we're more likely to see is regular influenza in the
That's
country.
right.
Right?
That's right.
Yep.
I didn't.
Go ahead.
I'm sorry, I didn't hear your last question.
So going forward now, with folks, they need to get a flu shot. They need to help prevent the spread of flu. If you're sick, stay home. And if you're around somebody who's sick, try to avoid them. Wash your hands a lot. Cover your nose. If you're sneezing or if somebody's sneezing and you try to cover up, try to prevent the flu when you can. But influenza is a bad dude, and it's going to be more prevalent this year than Ebola virus. We're convinced of that in this country. Any final comments from you, Dr. Wiley?
Well, you know, I just want to stress the main point, and that is get vaccinated. That is the best way to prevent from getting influenza. As I think Dr. Caton said, this year we have the influenza out with 4 different strands of the flu that we're covering: influenza, 2 influenza A's and 2 influenza B's. There's also, for the children between ages 2 and 8, they now recommend, if they don't have any contraindications, the flu mist spray that causes the patients or the children to have better immunity. And then for our folks that are 65 and older, there's the high-dose flu. But one thing that the CDC really strongly advises, and that is wherever you can get the flu, and wherever you can get the influenza vaccine, and whenever you can get it, get it. Don't wait for these other vaccinations. Go ahead and get it, and you want to get it now so that your body has a chance to make antibodies so that when we get into the peak of flu season that you'll be protected.
Final words from you, Dr. Caton.
The only other thing I would recommend is what y'all were just talking about was, yes, get vaccinated. The other thing is the sanitizer that you were just referring to, and like using the sanitizer like Lil Perel or what.
Yes.
Use it anywhere you go, at the gym, at the grocery store, at church. And make sure when you are touching other people's hands, don't put it straight to your face afterwards, because if it comes into your nasal passages or in your mouth, you're going to get the flu. And that's how we get the flu. And I know I'm just as guilty as other people. Sometimes I'll forget to do that. But we got to make a very strong effort when we're using different machines at the gym to make sure we're cleaning our hands and not putting them straight to our mouth or our nose.
Yep. Thanks to you, Dr. Caton, Dr. Wiley, and everyone out there for watching another edition of Healthy Hangout, sponsored by Baylor Scott and White Health. See you next time.
Thank you.